Well, I'm also joined by Bushra Khalidi. She's the Oxfam Occupied Territory and Israel Policy Lead. And she joins us live from Ramallah in the occupied West Bank. First of all, how severe is the situation becoming in Gaza now? This is a month on almost, and the UN has talked of the need for fuel, food and medicine being acute now.
I just got off a call with family members. The situation is really deteriorating by the hour. If we are able to even get updates as frequent as that, we're able to speak once or twice a day because of communications not being completely restored. They queue for 4 to 6 hours for water. A bakery today in Gaza City was bombed. Solar panels were bombed at Al-Shifa Hospital. Al-Shifa Hospital is sheltering 20,000 people, plus 3,500 patients. There's no electricity. There is no aid getting to Gaza City. It's only being distributed to the south. So the situation in Gaza City is even more dire. Bottled water is impossible to find. Sweet water is a scarcity. Even communities there's tension between the community because of the lack of water. The hygiene and sanitation situation is unfathomable. The number of wounded, the avalanche, as Dr. Ghassan Abu Sitta said it from Al-Shifa, the avalanche of wounded is unprecedented. To the point that hospitals are not treating patients that would need access to a ventilator because of the lack of electricity and fuel.
Indeed. And Bushra, how do you get aid in now practically against this backdrop of constant bombardment? We've heard today from the UN Secretary General saying the reduction in the amount of trucks that are getting through now is huge.
You get aid by implementing an immediate ceasefire. It's very simple. In any situation like this, we heard Antonio Guterres, and we welcome his words today, saying that the record numbers that we're seeing in what's happened in 4 weeks in Gaza, the impact on civilian population is unbelievable. An immediate ceasefire, that's what will allow aid to reach Gaza City, to reach the north, and to open the borders, and not just Rafah. Israel has clear duties and responsibilities under international law as the occupier. It imposes an illegal blockade on Gaza for the last 16 years and should also open its borders to allow aid in and goods in. We also need medical teams inside Gaza. We need wounded to be able to reach Rafah and be evacuated if they can, without the risk of being struck or bombed. So all of these conditions need to be in place. And fuel is an essential item that needs to be also allowed in with the aid. And we need the restoration of services of water and electricity to Gaza.
OK, Bushra Khalidi joining us there, Oxfam's Occupied Territory and Israel Policy Lead. Thank you very much for joining us from Ramallah in the occupied West Bank.
Thank you.